$10 doesn't buy too much these days, but what if I told you that it could save your life? That's right, just $10, the price of a remarkable blood test that can uncover a killer inflammation hiding in your body, even if you are young and apparently healthy. Dr. Timothy Johnson with some sound investment advice, the best money you may ever spend.
Tragic heart attacks that can strike without warning and end your life in an instant.
Half the people who have heart disease find out that they have a heart problem by dropping dead. That's the first symptom they have.
Lucky for Regina, her next stop was cardiologist Dr. Richard Fleming, author of Stop Inflammation Now.
I want to take a listen to your heart and lungs.
He routinely tests blood for signs of inflammation in coronary arteries. When Regina tested positive, he also did a high-tech nuclear stress test to get a better picture of her heart. What he saw was alarming.
We clearly had information that there was inflammation going on and that we needed to treat it.
Dr. Fleming, for one, needs no convincing that inflammation is fueling killer heart attacks. He also believes that a diet high in calories and saturated fats makes it easy for arteries to become inflamed. The best way to put out that fire, he says, is with a healthy lifestyle.
Physicians like myself only have so many tricks we can pull out of the hat to treat the symptoms. Until we treat the underlying cause, we're not going to correct these problems.
Use a spoon to get that out of there.
Regina's cholesterol is already normal, so cholesterol-lowering drugs are not the answer for her. Instead, she is sent home with a low-fat diet designed to help her lose weight and eliminate foods that trigger an inflammatory reaction. Phase 1 is tough. She's restricted to fruits and vegetables to quickly lower inflammation.
Oh, this is good.
Once that's under control, she can add protein, grains, dairy, and healthy fats.
Actually, I felt better. I felt like I had more energy than I did at first.
The first sign this diet might be working for Regina was that her chest pain stopped. But the real proof lies in what's going on inside her arteries. 3 weeks later, Dr. Fleming does another CRP test and heart scan.
And then I want to sit down and go over the test results with you.
Amazingly, Regina is turning the tide on her heart disease.
The inflammation has really gone down.
In fact, her CRP level has dropped in half.
It's not completely normal yet, but there's been a big drop in the inflammation by the numbers and even some improvement in the blood flow to the heart. So you're on your way.
Well, I have been feeling better, so that's great.
Do I have breast cancer? Do I have, 6 months to live because I have a lump? What is it? Is it just a lump? Is it malignant? So B.E.S.T for me meant that I was able to know what my breast health looked like and what I needed to do. Do I need to continue with further treatment, or, was everything okay?
I was introduced to the B.E.S.T test by my surgeon, and I wanted to absolutely be a part of helping other people down the line so that they could find out earlier and take the steps that it would be necessary so that they don't have to go through the surgeries and the chemo and everything else. So if it's something that can be eliminated for women of the masses, then of course, and it was such an easy test to take. It wasn't, I had harder tests in high school.
Ever since I was probably about 19 years old, I felt a small little lump in my breast. And so I've been getting routine mammograms since I was 19 years old.
Yeah, well, because I still have one natural breast that the test has showed up that does have some possibilities and some areas of concern. So I think that taking the steps, to prevent any further invasion on the other side is very helpful to know. Because originally I was considering just doing a double mastectomy. The plastic surgeon sort of talk me out of it at the time, and I'm glad he did. But, so it's just something that I have to keep an eye on.
So this is an image of your left breast, and these are the regions of interest here drawn in this particular case. So you have a lot of small circles, and then you see this big zone out here. So that big pink zone is over 90% of your breast tissue,
right? And
its maximum count activity is a 396, which, if we look at the numbers, then puts you at 360 or greater, then we predict the presence of cancer. Now, this is your left breast again, and you can see this entire bottom third of your breast is at a 190, which is just in the inflamed category, just barely above healthy. 194, the same thing. So over half of your breast seem to be perfectly fine, but it's way back here on the back, just a few millimeters in size, but it jumps up to a 450 and a 444, with 360 being kind of the minimum threshold for a cancer. So that tells us it's back here against the chest wall. So this is your right breast, and we're getting numbers in your right breast at 154. A 181 is this red circle, so that's maybe a third of your breast tissue. As we get larger, this yellow region there is a 249, and then it begins to go up. You have an area there that I would say is a concern. But based on these numbers right here, we're showing a high degree of inflammatory process, possibly precancers and possibly atypia.
I would like to take another B.E.S.T test, yes, to see how things are going. I mean, maybe after the chemotherapy and radiation, because I also want to know what sort of maybe impact that has had, because if any, on those cells that were there. Has it improved it? Has it made it worse? Because the chemo sort of knocks out your immune system, so I don't know if it makes it worse or if the chemotherapy would eliminate those precancerous cells. So it would be something I'd be very interested in seeing how that had if there was any effect from that. Yeah, I don't know what kind of breast tissue I do have, but I do know that the mammograms are fairly inaccurate either way. And the information that I got off of my B.E.S.T test, even though I already had cancer, was very enlightening to see. And like I said, it gives me some information on the healthy breast that's remaining.
I think that women with dense breast should take this test because it's able to detect the inflammation immediately. With dense breast, you have to go through a mammogram, then you have to go through an ultrasound, then possibly a needle biopsy or a surgical biopsy. And there's 4 tests that you have to go through with, of course, the waiting period. And then the last 2 are invasive. The B.E.S.T test is not. For women with dense breast tissue, mammography does not work.
Yes, I do have extreme dense breast tissue. My radiologist tells me that it's about 90%. So how I learned about the B.E.S.T test was actually through a really good friend of mine who has been an advocate, a personal cheerleader throughout the entire process. And because I had breast cancer, she felt that this study would be extremely beneficial to me. I think that the B.E.S.T test has the ability to, on a long-term basis, to really predict small, minute changes cellularly. And I think that I would want that. I think it gives the physicians, the specialist, a whole picture of what's going on inside the breast.
I don't believe that a mammogram saved my life, honestly. They didn't find my cancer, so my screening mammogram did not save my life. I believe being aware of my own breasts saved my life.
So a year from now, it's going to be important and exciting to tell patients, to tell women that what they've been doing all along is working. That they don't have to be fearful about, it's always wondering in the past, did I do the wrong thing? Did I cause this? Could I have done something different? You know? And when you get this result that shows that in fact you do have healthy breasts, it's amazing. It's when I got my low number, it was like, all right, right on, you know, living a healthy lifestyle, exercising and eating well. It's important, and it means to me that it's working. B.E.S.T does exceed my expectation because it gives me the information I need to know now to either change what I'm doing, meaning the types of food I'm eating, my supplements that I'm taking, and to diminish any inflammation that I might have.
I really feel confident in my decision of doing the B.E.S.T test as well as being on tamoxifen. In years to come, when I get tested again with the B.E.S.T test, and so then we can really see if even the drug is working. So that means I need to make really, really good, informed decisions. I think that the B.E.S.T test is one of the pinnacle marks that will help women and men make those hard choices and really help people to not live in fear and not to live a life of regret.